generalist hematologist oncologist in the community. I'm part of a pretty large group practice where we see all types of solid tumors, blood cancers, benign hematology. I think in terms of sparking interest, probably a lot of doctors have their own personal stories. For me, I went into oncology because I had someone in college, a friend actually pass away from cancer at a young age. So that led to a journey of being interested in oncology. And then as part of the world of oncology, there's a lot of research. And I think having that interest in the combination of taking care of people in the community, but also having research ties, that's the space that I occupy. Just to take a little bit of a step back, I think AI, even though it's been around for decades, just in terms of artificial intelligence being a technology available, I think now in medicine we're starting to realize there's just this massive explosion of information. It seems like there's new research and FDA-approved treatments and just understanding of diseases. The amount of data that we keep track of, patient information, is just a huge growth. So I look at it right now, even though there's heterogeneity in practices and how we're using AI, I think there's probably some centers that embrace it quite a lot and they're spearheading it. And then in the community, I think we're still very much attached to the relationship to patients on a personal level. So we haven't necessarily engaged in AI for patient-facing use, but we may use it. For example, I use AI for looking up information and also a little bit of scribe, a little bit of just being able to pull a lot of information very quickly. I think you have to be very careful though. You have to curate that information and then validate that all of the facts are correct. There's still a little bit of knowledge gaps with the quality of the AI. So I would always be very careful that it shouldn't supplant medical knowledge or skills. It's more just a tool to try to be more efficient. And then in the community, it hasn't really been a way to interface with patients yet. In the future, it might be. It might be a way to try to obtain a lot of patient-reported issues if they're calling in and they have just a lot of information that they want to either give to us or ask questions about. But I think right now it's very much of we're trying to see how it should fit in, because there's also that concern of how much is it, even just on a philosophical level, how much should we be using AI? Because a lot of the duty and the responsibility of caring for another person, we don't really want that to disappear from an actual human that's been trained. So some specific areas that I think could be very helpful, like just getting down into what specific areas of data. I think, for example, in hematology, we sort of think of it like solid tumors are a system of organs that it's a little bit easier to think about, but hematology is this wide universe because it's literally your blood flow is just, it can get very nebulous very quickly. And when looking at blood itself under a microscope and looking at the blood cells, I think being able to use AI to scan blood under a microscope on smears very quickly and make accurate diagnoses, I think there's some interest there. I've seen for large scope meetings of lots of physicians, or even just smaller meetings, we use AI to try to capture a lot of the conversations and chat. So we've probably all seen a little bit of that AI assistant or like a chat bot. So just being able to download a lot of information very quickly and condense it, but still be just a tool, not replace that very important physician relationship with the care team and with the patients. It certainly has areas that can be helpful, because sometimes when we're trying to make a diagnosis, as medical oncologists, we rely very much on our multidisciplinary teammates. So for example, pathology, we very much need a pathologist to help us say what the histology is. Like if they say it's a type of leukemia, we really need to know the subtypes, we really need to know molecular markers, and a lot of these things, it's very much we make a clinical correlation, meaning we look at the diagnosis and we try to fit, does that make sense with the patient? But we do very much rely on the trained pathologist, or in a similar analogy is the radiologist too. If they say something is abnormal, an anomaly, and then it's either growing or shrinking, we have to clinically correlate as the hematologist oncologist to say, does this make sense and what does it mean? And I think whenever there is discordance, that's when we start questioning the diagnosis. Sometimes it can get very tricky when it's a subtle change, like sometimes maybe it's not a complete incorrect diagnosis, but just there's some details about, for example, a carcinoma has a certain grade. Is it a higher grade or a lower grade or an intermediate grade? There's all these details that it can be really hard to tell where in that huge multidisciplinary interaction that there might be some source of error. So I think having the safety net of AI, using it to double check when there is a question and confirming, like being able to check multiple times. It's almost kind of like running something through a calculator and getting the consistent answer and feeling reliable about it. There's that safety net, but I think also not to underestimate that human beings also have some built-in supercomputer too, which I think of as the intuition. Like sometimes when you see a person, maybe AI has some computing power that's faster than the human neuron connections, but I still think the ability to, all those years of training that we do and the collective repetitions that we get of seeing patients in the clinic, especially in the community, seeing high volumes of patients, I still think that working together with AI is very important, but not to completely supplant. And then there's always a consensus building process too, of what do we think in the medical community and for patients, what do we think is acceptable amount of reliance on AI, certainly not 100% reliance. I think if we have specific questions, then we could probably design AI for answering those questions. So for example, I think of in radiology, we often use certain types of criteria for how to measure progression or response. And so in clinical trials, we call it the RECIST criteria is the traditional criteria. And even then we know that that can be problematic, because just because something changes in size doesn't always correlate directly and only exclusively with that parameter to patient outcomes. And there's a lot of nuances too. For example, if we're using immunotherapy, sometimes the RECIST criteria of things getting bigger or smaller are not necessarily telling you something about the cancer getting worse or better. So I think the role of AI there would be trying to do pattern recognition very quickly and collecting trends, perhaps being able to help the radiologists in their day-to-day when they have to scroll through so many slices that make up a CAT scan. It comes down to that theme to me of trying to condense an overwhelming amount of information so that we can manage it, but not replacing completely that ability for a human being to recognize there's something not well about another human being, still that gestalt. I think also in terms of just going back to the world of leukemia and blood disorders that's so complex, where sometimes it's extremely challenging clinically to tell if someone's doing better or worse, because the treatment and the disease can both yield similar symptoms or signs. So if someone is having, let's say they're feeling much worse, is it the treatment wiping out their bone marrow, or is it the cancer, let's say leukemia, coming back and progressing, and being able to do procedures such as a bone marrow biopsy, or being able to collect peripheral blood and being able to scan all that information and then get molecular information out of that. I think that can get very daunting to try to put that all together and understand, so is this disease or is this treatment? So I would think that the use of AI could be to make distinctions that are a lot more elusive when it comes to what the clinician is able to do, no matter how much training or no matter how much experience we may have, because of how fast the new treatments that are coming out and we're trying to learn them, and then also the unknowns of the long-term effects of some of these newer treatments. So trying to use AI as a learning partner to help us learn quicker, but again, not to say that we don't even have some judgment. I think we would decide, does the ultimate result that AI produces that guides us one way or another, is it somewhat illogical? Does it make sense? And is there a way to check that? Because sometimes with AI, the other thing is the accessibility of how do we understand the algorithm of how it arrived to its answer. You know, I've heard the term thrown around, it's not so much artificial intelligence, but more maybe alien intelligence. Like it's an intelligent force. We just don't, it's not the way that humans think. And so we still need to respect the way that an answer is coming about. And it's not in a way that we may necessarily understand how did it come about. And sometimes the how is very important, because if you're trying to go back and check the logic of how you arrived to that answer. So with a human being, you can ask, you can communicate, and like, what's your justification? But with AI, you can't really interact with it in that way without necessarily being the engineer. And even then, you know, AI is dynamic. So I think the going back to that theme of, it can be helpful, it can also get very convoluted if we're not just keeping some simple core values of wanting to put it in a very specific place of answering very specific questions, and not completely taking the role of what a clinician is doing for patients and an entire multidisciplinary team. That certainly goes back to a lot of what I'm mentioning now. I think it makes it very difficult to know for risk mitigation or medical legal consideration if we say, someone actually has a misdiagnosis from AI. I think there's a little bit of this assumption that just because it's coming from another intelligence, that humans are more prone to error, but another intelligence is closer to perfect, and it's going to catch everything. And that may be a little bit of adding a degree of confidence I'm not sure we can completely justify. So sometimes if we get something from AI, like let's say if we designed a patient-reported chatbot, and the patient says, I'm feeling very sick, and then the chatbot says, don't worry about it because it sounds like it's just something not as serious, and then it turns out to be much more serious, but it was taken care of by AI and there wasn't a person there. So then now what's the ethical implications of who decided to put AI into the patient-facing scenario, and who would really be responsible in that situation, especially with that assumption that we are essentially making that AI is going to be as good, if not better, as human judgment, which it's very viable that someone can call and a human can make a very similar error too, of going, oh, that doesn't sound so serious. So I think that's a big reason why, for at least in the community setting right now that I'm observing, we're really not wanting AI to enter right now completely into the patient-facing arena without a very serious conversation and having of course, patients know transparently that that's what they're interacting with. And I think having those legal conversations too of whatever we're doing, what's actually happening in terms of our responsibilities and our obligations and the risk that we're introducing into care. So I think having a lot of thought is very important. It is not, I don't think it's a reason to completely dismiss AI, because I think with so many different forces at play, for example, potential future physician shortages and certain communities having more hematologists, oncologists than others, or quick transitions of losing physicians, getting new ones, and then the mass amount of patients who have hematologic disorders or cancers that need service. I think we do need some leveling up of the tools that we use to digest all this massive information, with the human power being dissonant, where we've got so many more patients and so it feels like fewer well-spread allocation of healthcare providers. I think we do need help. So I wouldn't say, oh, let's just not do that at all. But it's just that evolution together with the AI and with people, and making sure that we don't lose the humanity part of it, where there's still the very important components that maybe aren't measurable, but still are very obvious in patient outcomes. Things like how they feel better just having a care team that they trust and they feel cared about. They're part of a community. They feel there's someone that they can always rely on. Those are things that I don't think AI can ever completely take over, and we should never let the intelligence portion, the artificial intelligence portion, make us feel like that's always going to be outperforming human performance. I think whenever I think about AI, I think about kind of like historically how it came about in decoding in World War II. I think about it in like the IBM beating the human being. So there's a little bit of that aura around AI being so much superior than us. But when it comes to healthcare, I think we have to be just very careful about that, because then you start getting a little bit of complacency of, oh, they're going to get it right, so that's okay, to just completely rely on that judgment. I think